Hi, I'm Kristen, and I've had my ostomy for 15 years. Ostomy surgery can be life-changing. Over time, with the proper system and support from medical professionals, family, and friends, life is not only livable, but enjoyable. Since my surgery, I've dated, attended college, gotten married, and had a baby. I would not enjoy the quality of life that I have today without ostomy surgery.
Hello, I'm Gwen Turnbull, and I'm here to help you learn about using the Esteem Synergy Ostomy System. This unique system was designed to simplify your life by providing you with the security and comfort you want in a discreet, versatile system. Ostomy systems use special adhesives or skin barriers to attach pouches to your body. Traditionally, ostomy systems have been available in two basic styles, one-piece or two-piece. In a traditional one-piece system, the skin barrier and the pouch are bonded together to form a single unit. In a traditional two-piece system, the skin barrier and the pouch are two separate components that use plastic rings that snap together. The Esteem Synergy Ostomy System uses adhesive coupling technology to directly and securely connect the pouch and the skin barrier. The security of the new adhesive coupling eliminates the need for more traditional plastic rings. It also allows for easy application and removal and easy access to your stoma. During the next few minutes, you'll have an opportunity to see techniques for using this innovative ostomy system. We'll carefully review easy-to-master steps to help you apply and remove your ostomy system. First, you'll see on screen all the products and supplies needed for application and removal. Next, Kristen will demonstrate the best way to apply and remove your ostomy system. At the end of this demonstration, a resource guide will appear on your screen. This guide contains telephone numbers, mailing addresses, even internet locations of organizations offering support and information to ostomy patients and their families. Before handling your ostomy system, always wash your hands with soap and water. To follow our demonstration, you'll need to assemble the following items. Please take a moment to do that now. You'll need a Convitex skin barrier wafer using the patented stoma adhesive skin barrier, a stoma measuring guide, your pouch, a Convitex tail closure if your pouch is a drainable one that does not have a clipless tail closure system, stoma adhesive paste, a pencil, curved scissors, 2 clean washcloths, all care remover wipes, all care barrier wipes, and a mild soap. If you're using a pre-cut wafer, you won't need the measuring guide, pencil, or scissors. If you're using a drainable pouch with the Invisiclose tail closure, you will not need a tail clip. Now, carefully remove the system you're wearing. To remove the old adhesive, clean the surrounding skin with an all-care adhesive remover towelette. Lift a corner of the skin barrier or tape. Wipe the adhesive remover towelette between the skin and the adhesive. Gently peel the adhesive back while continuing to wipe. Then wash the skin thoroughly with a mild oil-free soap and pat dry. Remember that any oily substance will cause poor adhesion of the wafer. For extra protection against skin irritation, you may use an all-care protective barrier wipe. Simply apply all care to the area, let it dry thoroughly, then apply your ostomy system. Next, take the stoma measuring guide, place it over your stoma. Measure the widest part like this. If you recently had your surgery, it is important to take stoma measurements each time you apply a new skin barrier. Your stoma will continue to shrink for several weeks after surgery. If You should consult with your healthcare professional to determine the proper size pouch and skin barrier for your stoma type and size. This is a Convatec Esteem Synergy Skin Barrier Wafer. For reference, this is the part of your wafer known as the landing zone. The adhesive on your pouch will adhere to this landing zone. Now carefully trace the stoma outline you selected onto the release paper. Using curved scissors, enlarge the hole to match the outline you drew. Make sure you do not cut beyond the last line indicated on the release paper. Now, remove the circular release paper. For additional security, you can use a small amount of stoma adhesive paste to fill the gaps between your skin barrier and your stoma. Apply a thin ring of stoma adhesive paste to the back of the wafer, closest to the opening you have cut. Do not spread the paste. Allow the paste to set for 1 minute prior to application. Center the hole over your stoma. Press the skin barrier into place, holding for 30 seconds to a minute to ensure that it fits around the stoma. Remove the protective paper from the tape collar and smooth into place. It is recommended that the barrier be changed after 3 days of wear. If you have a flush or retracted stoma, you may need to use a convex product to increase wear time and comfort. Please contact your healthcare professional or Convatec's Customer Interaction Center to learn more about these options. One easy-to-use option is the Adhesive Skin Barrier with moldable convexity. If you do not use the moldable convex skin barrier, you may wish to fast forward through this section. To use the moldable convex skin barrier, you will need the skin barrier wafer and the clear package tray, a pen, and a stoma measuring guide. Measure your stoma and use a pen to draw the pattern onto the clear package tray. You may wish to cut the pattern out and use the clear plastic tray as a template or guide for future use. Next, trace the stoma pattern from the tray onto the plastic backing on the body side of the skin barrier. With practice, you may find that you can mold the stoma opening without even tracing a pattern. Now, with the flange side facing you, press the raised center portion of the plastic cover into the starter hole until the center portion protrudes outward. You're now ready to customize the stoma opening. Place your fingertips or thumbs at the edge of the starter hole and begin to roll the skin barrier back. Continue to roll the skin barrier until you are able to see the pattern of the stoma on the plastic backing. If you roll it too far past the line, you can simply roll it back. Remove the plastic backing from the skin barrier, but do not remove the white release paper yet. You are now ready to apply the skin barrier over your stoma. Center the opening over your stoma and press the skin barrier into place. Smooth the inner edge closest to your stoma with your fingers. Hold it in place for about 30 seconds to ensure that the skin barrier hugs the stoma. Remove the white release paper from the flexible tape border and press it into place. You should smooth out any wrinkles in the border. Now we come to the final step, applying the Esteem Synergy Pouch adhesive ring to the landing zone flange. Before applying the pouch, let a small amount of air enter by gently separating it. Keep in mind that Esteem Synergy pouches are designed to fit the natural contours of your body. The curve is designed to fit comfortably around your leg. There are pouches designed to fit on either your right side or your left side. Ask your healthcare provider which is correct for you. Make sure the landing zone is completely clean and dry. Now, carefully remove the release paper from the adhesive ring on the pouch. Rest your finger at the bottom edge of the landing zone. Using that finger, align the bottom of the pouch adhesive ring with the bottom of the landing zone. Roll up the lower portion of the adhesive ring from the bottom to top, making sure the entire adhesive ring is in the landing zone. Run your finger around the pouch to make sure it's smooth and wrinkle-free. Another method of applying the pouch is to fold the adhesive ring. Apply the lower half to the bottom of the landing zone, then roll or slide your fingers over the upper portion to secure the pouch in place. If it's not on right, remove it and reapply it, because wrinkles can result in leakage. You can easily change or reposition the pouch. Simply peel the pouch from the landing zone by holding the tab on the pouch adhesive ring with one hand and the edge of the landing zone with the other. Peel the pouch downward in a rolling motion. If the landing zone is wet or soiled, wipe it with a clean cloth and pat dry. An additional feature of the landing zone is that it allows you to easily verify the security of the pouch to landing zone connection and determine when it's time to put on a new pouch. By folding back the landing zone, you actually see the connection between the landing zone and the pouch. It is not uncommon for some stool to migrate toward the edge of that adhesive foam. As you become accustomed to using this feature of Esteem Synergy, your individual wear pattern will become evident and help you determine when to change your pouch, reducing the guesswork. If you're using a drainable pouch, apply the Convexity tail closure. Simply fold the end of the pouch over once, slide the tail closure over the fold, and snap it closed. If you're using a drainable pouch with the Invisiclose tail closure, hold the security flap against the front of the pouch, revealing the interlocking closures. Fold the tail end up towards you 4 times and press the interlocking closures together until you feel them lock or click into place along the entire length. Wrap the security flap around the back of the pouch and press the interlocking closures together until you feel them lock or click into place. Right side pouches have 4 filter slits. These 4 slits allow you to regulate airflow through the filter to deodorize gas, facilitate drainage, and help prevent ballooning of the pouch. You can use the filter covers included in the box to cover one or more of the slits. The more slits you cover, the more you will reduce the airflow through the filter. If you use a drainable pouch with an air filter or a closed-end pouch with a filter, you must cover the filter during bathing, showering, swimming, and other water activities. Convenient filter covers are included in the box. Esteem Synergy urostomy pouches feature the AccuSeal tap, which securely closes the pouch while you're wearing it and allows easy draining. Simply twist the swivel valve so that the red dot faces away from your body. This indicates the tap is open, as you see here. The tap can also be attached to a nighttime drainage system if you wish. As you get to know the Esteem Synergy ostomy system, you'll appreciate the revolutionary adhesive coupling technology, which enables you to easily remove and reattach the pouch to the skin barrier up to 25 times. You'll also find Esteem Synergy's design to be flexible and barely visible under clothing. Here are some additional application and removal tips. Remember to empty the pouch when it is 1/3 full. Never use soap or even mild cleansing agents inside the pouch. You can rinse it out, however, using lukewarm water. If you use a closed-end pouch, you may simply remove it and discard. You may wish to use a plastic bag with a zip closure for added discretion. If you need more assistance, please contact your healthcare professional or call Convexy's Customer Interaction Center at 1-800-422-8811. It's going to take a little practice before application and removal of your ostomy system becomes routine. Until then, just remember to prepare everything you'll need in advance and take your time. If you're experiencing difficulties or have any concerns at all, please consult your healthcare professional or doctor immediately. And take advantage of the many fine support resources listed in the resource guide appearing next. I hope this introduction to the Esteem Synergy ostomy system has been helpful and educational. Thank you for watching. The following is a listing of electronic bulletin boards called news groups available on the Internet. These news groups provide online peer-to-peer support to ostomy patients and their families. For information on news group access, please contact your Internet service. Convatec does not support or endorse the advice or content contained in any news group or web. These news groups are listed for informational purposes only.